afternoon, good evening. Thank you so much for joining us for the AfricaCDC Mpox briefing. Coming live to you from Kinshasa, DRC. And my name is Margaret Edwin, the Director of Communications. I will be moderating the session. I will now hand over to our main speaker, Dr. Kaseya, the Director General of AfricaCDC, who will provide the situation analysis and introduce the other key speakers on this panel. Over to you, DG.
Good morning, good afternoon, good evening to all of you. As Margaret said, we are taking this press conference from Kinshasa, where we are together with Laurent Michel, who's leading the European Emergency Agency called ERA, and with Dr. Moiti, who's the regional director of WHO Afro. Then together we are here first to provide an update on the epidemiological situation of Mpox in Africa. Second, to talk about the continental response plan, and third, to discuss about to give an update on the vaccines. And we thank European Union through ERA for the support given to Africa. As you know, yesterday, for the first time, we got around 99,000 doses from European Union through the partnership that we built, European Union, ERA, Bavaria Nordic, and AfricaCDC. The support from Africa, from European Union, is critical to curb the trend that we see on the Mpox outbreak in Africa. We'll have also opportunity for all of you to be briefed on the continental response plan that WHO and AfricaCDC co-led with the support from all partners, and you'll see the logos, and you have opportunity to familiarize yourself with this continental response plan and the way we are moving with that. But the first agenda item is the update on what is happening today. We can maybe request the few slides to be projected. Can we project? Okay, this is, as you see, the joint press conference, AfricaCDC ERA. Next slide, please. Okay, next slide. Okay, colleagues, for the past 7 days, we recorded 5,466 new cases. Out of that, 252 were confirmed Mpox, and we lost 26 people. As we said, one death is a major issue for us as partners, and we need to stop seeing people dying from Mpox. You will see that if we start from week 1 to date, we have an increase of cases, but the case fatality rate is going down because now we are reporting a number of cases, but we are also strengthening the capacity of member states to take care of people who are affected, while we are also providing more information through the communication, risk communication and community engagement for people to come early to seek for support. Next slide, please. Next slide. You are now familiar with that one. this slide is showing you the from 2022 to 2024, we have an increase in terms of numbers of Mpox. And you will see when we declare the public health emergency of national security, we still continue to record high number of cases. And that one is a major issue because we want to stop that. Next slide. Next slide. Okay, when we talk about these cases, wanted to share with you where are these cases. You'll see mostly it's in Central Africa, but we still have cases in other regions. This week or last week, we got the report from Guinea reporting for the first time the case, and that is still under sequencing to know if that one is clade 1 or clade 2. I hope we can have this information very soon, even before the end of this meeting, to update you. But it's important to see that if in a few weeks ago, DRC had 96% of all cases, today it's 91%. It means other countries are also coming. And this is an indication that the outbreak is really moving, and we really need to stop it very quickly. Otherwise, we can see many other countries affected, like the case of Guinea. Another slide. We wanted to speak about 3 countries. The first one is DRC. If you see that slide, we still have this major issue of children less than 15 years being the most affected ones. In DRC, they are 58%, but when we see Burundi, you'll see the trend is almost similar. And we know the factors like the insecurity in the eastern part of DRC and the population mobility. We know that malnutrition and low vaccination coverage are driving also this agenda, in addition to some other factors that are related to unsafe sexual practices and the poor sanitation. That one is similar to the next slide. Next, that is talking about Burundi. Next slide, please. Okay, if you see in Burundi, it's almost the same trend, because children under 15 represent 54% of all confirmed cases. That slide is showing us we really need to focus on how to support the youth. There is a major issue in terms of communication. There is a major issue in terms of the way we are conducting some programs to protect our young people. We saw in some regions, less than 5 years represent around 38%. And the way the disease is transmitted to them is either when the mother is pregnant, or the mother is breastfeeding, or after when they are released from the maternity and the mother is sick, the contact with the mother or the father. I think that one is a major issue, because we really don't know what will happen next. Next slide. Next slide, please. That slide is the last one I wanted to share with you today, is about Guinea. We had 4 suspected cases. Among them, the confirmed case is a child 7-year-old. And you will see that DRC and Burundi are mostly clade 1, affecting young people. If in Guinea, it will be also clade 1, it means we need to understand what is going on. It will be the first time for us to have one clade 1B in the western part of Africa. But we don't want to jump to conclusions. We are waiting for the genomic sequencing, and led by epidemiology, I'm really concerned to see that it's a 7-year-old child that is coming. Next slide. Next slide, please. I will stop here. I will hand over to Dr. Mweti, because as you know, we agreed in Africa for the first time to have all of us coming together under the co-leadership of WHO and AfricaCDC to develop a continental response plan. Dr. Mweti, I hand over to you to explain to our journalists what is the spirit beyond all of that and the way we can move forward. Over to you.
Okay. Okay. Thank you very much, Dr. John Kaseya, the DG of the AfricaCDC. I'd also like to greet the DG of HERA, Dr. Laurent Michel, and warm greetings to the members of the press. Ladies and gentlemen, good afternoon, good evening, or good morning to you, depending on where you are. Thank you so much for this opportunity to join with my dear colleague, Dr. Jean Kaseya of the AfricaCDC, and explain to you and present to you this joint continental plan that we have collectively developed in order to support our member states in responding and preparing for this Mpox outbreak, working with many, many partners. I'd like to signal that this is something that is a unique approach that we are taking as joint partners that play a leading role in preparedness and response to disease outbreaks and emergencies in the region, and acknowledge the input of all the partners. We worked also with some independent experts to very quickly develop this continental plan. Let me also express my appreciation to the DG of HERA for the support that you are going to announce and the support that we enjoy from the European Union in our work on disease preparedness and response and on health more broadly. So you're very welcome to be part of this activity. So as partners, we are pleased to launch the Continental Preparedness and Response Plan today. And I'd just like to emphasize that this plan is not just a document. It is a demonstration of our shared resolve to strengthen health security on the continent. This is further clarified by the principles in this plan. And I'm assuming and have been informed that the plan has been shared, so our colleagues in the media have had the chance to have a look at it. It is very much country focused, first of all. It is science-driven, so the interventions are based on evidence. It places a strong emphasis on equity and solidarity. It represents a unified approach, as I said, co-led by the AfricaCDC and WHO, but involving many actors, not least the governments and the communities in the countries. We are putting in place a single collaboration mechanism, and it emphasizes a lot sustainability, so that what we invest in and what we do among ourselves with the support of partners can be sustained to improve the preparedness and response to future outbreaks. As I said, it will be co-coordinated or co-led, the implementation of this plan, by the AfricaCDC and WHO, but in close collaboration with many partners working under a unified incident management team, one plan, one budget, and we will monitor progress together within one framework. The goal of the plan is to support African Union member states to prevent and control Mpox outbreaks, the countries that are affected as illustrated by Dr. Kaseya in the presentation. with emphasis on achieving and sustaining control of transmission from humans to humans and also mitigating animal to human transmission. The strategy that we are adopting focuses a lot on a community-centered, well-coordinated, multi-sectoral, meaning not just health, but other sectors, and differentiated approach adapted to the situation and the risk in different countries. Member states have been categorized in the plan into 4 risk-based groups to better direct the preparedness and response efforts and the resource allocation more effectively. So that we make sure that most of the resources go where they are really needed at the right time. So we have 4 categories of countries. First, those with sustained transmission, and you'll recall the slides that Dr. Kaseya just shared with you. Those which have sporadic cases or where this disease has been endemic and therefore have endemic pre-existing reservoirs. And then thirdly, at-risk countries near higher risk areas. And then finally, other countries to sharpen their routine preparedness in order to deal with Mpox if it enters the countries. So this approach ensures that we have a targeted planning and we utilize the resources that we're anticipating to mobilize in the most optimal way for collective impact. We have 10 core pillars of implementation within this plan. First, very importantly, coordination and leadership so that our actions are coherent and they are efficient. Secondly, risk communication and community engagement, because we cannot do this if the people on the ground are not aware, are not enabled to play their part within families and households. And then thirdly, surveillance, so that we know where the disease is occurring, where it is spreading, and we target interventions for prevention, including vaccination there. Included in that is laboratory capacity and case management, ensuring that we provide care and treatment for people and prevent unnecessary suffering and deaths. 6, infection prevention and control. And then very importantly, 7, vaccination as a key tool in the response and prevention of further spread of this of Mpox. And then 8, research and innovation, because we have a lot to learn still to find out in order to make the best response and to continue to develop tools to deal with Mpox. Then operations support and logistics to get people, material, tools, supplies where they need to be for the action. And then finally, continuity of essential services so that while we are responding to the Mpox, we continue to do other things like provide vaccination, antenatal care, other essential health services to people. Excluding the cost of vaccines, which depends on the negotiation with manufacturers, in addition to donated in-kind that we'll be hearing later on. The estimated budget for the 6 months from now, September 2024 to February 25, is $599 million. And of this, just to say that just over half, 55%, is allocated for the Mpox response in 13 affected countries, and then readiness in 15 others, while just under half, 45%, is earmarked for the operational and the technical support through all of us, the partners that will be working together. I'd like to emphasize the importance of all the areas of intervention, in addition to vaccines as a critical prevention tool, and say that public health measures to know where the virus is spreading, engage the people, ensure preventive measures, and provide care are very important as well. So we've assigned a team from experts from WHO and the AfricaCDC to co-lead this continental response, to work with other partners in what we'll be doing in the various countries on the continent. I'd also just like to briefly say that following the declaration of Mpox as a public health emergency of international concern by WHO and a public health emergency of continental security by the AfricaCDC, we are already working to scale up the operational response in affected countries, deploying some resources and experts close to the affected communities. Just briefly, in the DRC, we are intensifying our support have established in Goma an operational hub. We've been able to procure more than $1 million worth of key medical supplies that we are providing in the country. And we have mobilized and deployed our existing staff in the country, about 400 field staff who are already in the country to support the key aspects of the response of what the government is doing. We are working with government to make sure that the fully trained national epidemic response surge staff that we work together to establish are already deployed as well. One of the areas that we're working on as well is to improve quality of care and reduce deaths, and we've trained healthcare workers in the DRC on that. And we have mobilized a team that deals with regulatory approvals to support 13 countries to do a joint review of vaccine dossiers. So then finally to say that we're already working with partners on the ground in the countries, DRC, Burundi, and other countries to leverage their capacities. And I'd like to recognize particularly UNICEF, the International Red Cross, the World Food Programme, the International Organization on Migration, the UN Refugee Agency, are some of the partners that we are already working with and we are going to be working with in the future. So I'd just like to conclude by saying we look forward very much to working together with the AfricaCDC and other partners. We look forward very much to your support, journalists, to get the message out there, to mobilize communities and other actors. And thank you very much for giving me the opportunity to present this plan. Thank you. Back to you, Lindsay.
Thank you so much, Dr. Monkey, for giving the summary of the contractor response plan and how we implement implementation. The next slide, next, if we can come back to the presentation, because the next slide is on update on vaccine. And DG from ERA will lead that. Next slide, please. Update. No, next slide. Next slide. No, I think you changed it. Okay. This is the update on vaccine. It's not then but over to you. Yes, please go.
Right. Thank you. I'm discovering the slides.
Yes, that's
as well. Well, thank you, Jean. Merci, Jean. Thank you, Dr. Monkey. As you know, I mean, it's all news because we yesterday already. We have received 99,000 doses at the airport of Kinshasa. It was a contract that we have negotiated between AfricaCDC, us, ERA, the Commission, and Bavaria. That's the first batch that we are donating. There is a second batch coming tomorrow on Saturday at 12:10, which will be of 1,000 doses. So that DRC will be able to deploy 200,000 vaccine for its vaccination campaign. So that is the first answer in terms of vaccination. Of course, we need to have an overall regional approach because, as Dr. Kaseya said, the virus is spreading across the region. And so we have decided that we work together with AfricaCDC and WHO, decide where the virus, the next dose should be. And in terms of donation from Europe, so there is this first batch from the European Commission, and we also the donation from our member states, and now that we are reaching up to 580,000 doses at the moment, and we are still putting some this is a mix of new doses that we buy to Bavaria models, so it's one of the new doses, and also using stockpile available in our models. So we are putting maximum to provide what is required. Because you need to have good vaccination strategies clades, and we're experts in the Minister of Health. The GRC to deal with the strategy, and I think we are on a good track to deploy the vaccine where it is needed to stop the transmission chain, to stop the different outbreaks in the US. The vaccine is authorized in Europe and in the US. There's an agency authorization and the US authorization, but it is also authorized so far in Nigeria and in the DRC, so the vaccine can be there. And we hope that in the coming days we'll be able to also to deploy the vaccine in other countries. One point that's in the question, which is important, is that the vaccine for the time being is reserved for adults. However, we have received some additional data from the company that the European Medicine Agency is analyzing at the moment. And by the end of the month, I hope that we will have a positive news that the vaccine can be released for children between 12 and 17. For the children below the age of 12, we are ongoing clinical trials, and we hope that we will have some also good news by the end of the year. And we know what type of dosage, what type of conditions are necessary to vaccinate small children. I stop here and happy to answer any questions. Thank you.
Thank you so much, Margaret. Three of us, Dr. Monkey, Dora, and myself are ready to answer the call.
Excuse Margaret, you're muted.
Mic is on.
You can hear me? Margaret was muted. Now we can hear me.
I can go with the question again if they didn't hear the question. Can you hear me? Okay.
Yes, we can hear you now.
Yeah, Dr. Moeti and myself will answer this question because you are also clearly saying we have around 580,000 doses already secured by ERA, and we are getting the first 1,000 doses this week in DMC, and there is a plan to continue to get vaccines. One of the conditionalities to get vaccine from each country is to have what we call the emergency use authorization from each country. And we already shared the form to each country. We got a response from Cameroon, we got a response from Rwanda. We're expecting to get response from Burundi very soon. We have a clear plan how to distribute this vaccine based on the epidemiology. Let me stop there and hand over to Dr. Moeti to provide additional response to this question.
Yeah, I'm very sorry. I'm actually having a lot of trouble hearing what you were saying, for example.
Oh.
Hello, can you hear me?
Yeah, just to complement, I mean, yes, we can.
We can hear you.
Yeah. I'm sorry, Dr. Kaseya, you were handing something.
Dr.
over
Moeti, we can hear you.
Okay. No, I was saying I couldn't hear what was being said before, but I heard him referring to passing it over to Dr. Moeti. So I hadn't heard the question, if there was a question.
Okay, what I was saying Laura would make it. Laura said we already secured 580,000 doses. And we are getting 200,000 doses in DRC, the remaining doses in other countries. One of the conditionalities is to have the emergency use authorization from each country. And the form was already shared with all of these countries, including Burundi. We already got response from Cameroon and Rwanda, in addition to DRC and Nigeria. We hope to get the form from Burundi very soon. Then we can deploy the quantity of vaccine. I think Laura wanted to provide additional information than Dr. Monkey.
I think you said it all, and we are waiting for the emergency use for Burundi, and then see what is the epidemiological situation. So we find the number of doses that are required, and that will be done in partnership between AfricaCDC, WHO, and us, and then the forward.
Dr. Monkey, over to you.
Okay, thanks very much. I'm really struggling to hear what's happening in the discussion. But I mean, just to, in terms of readiness and access to and approval of the vaccine, as I said, the Director General of WHO has issued an emergency use listing of the vaccines that exist and has agreed that Gavi and UNICEF can start to work together to procure the vaccines. I mean, we anticipate that the regulatory approvals for the use of these vaccines, which have already been approved for use in the US, in Europe, can be quickly organized so that the countries, as they are receiving the vaccine supplies, can start to use them. As far as I know, the DRC has already approved, and so have a couple of other countries. So just to emphasize that the regulatory approvals will not be a delaying factor in the use of the vaccines as they are becoming available in countries.
Thank you, Dr. Monkey. I'll just take the next two questions. Ina Mashumo from Avis de Afrique asks, Kisangani prison is on alert with 22 suspected cases detected. What measures have been taken to prevent the spread of the disease in this prison? Second question is, a first batch of vaccine has arrived in the country. Which category of people has been targeted for priority vaccination? And the third and last question is, the school year has just started. Do you think all preventative measures have been taken in the schools? Over to you, DG.
Thank you. I hope you can hear me. We'll answer this question, Dr. Moit and myself. Dr. Moit, do you want to start? Then I will provide additional information for the question.
No, why don't you start? Then I'll compliment you.
Thank you. We were discussing this morning about populations that will target for this vaccination. And we included people who are in prison, and we included people who are internally displaced people, IDP. Why we are saying that is because mostly prisons in DRC, we found more people than planned. And this is also a place where we can easily see the spread of the disease. And all prisons in DRC, mostly in big cities, are part of the plan that the country provided. And in terms of categories of people who are targeted, the country, if you are talking about DRC, they have a clear plan. In their plan, they are talking mostly about people who got the disease, the contact of the people, and the second contact of the first contact. We have also community health workers because these are people who are supporting for the response, and by looking at community level, those who are sick and bringing them at the health center level. It means they are also at the risk. We also have health workers, it means nurses and all of them, who are in contact with those who are infected. We need to protect our health workers. We are also targeting sexual workers, as we saw in the eastern part of DRC mostly. We have the sexual transmission of the disease, and we are also targeting children with malnutrition. These are the decisions that the country made for the vaccination campaign. Yes, September is the time learners are going back to school. In DRC, Burundi, Rwanda, Uganda. Yes, there is a reason for all of us to start to think if there are appropriate measures. But we believe that the government decided to resume the school by putting in place all measures. Our role is to advise the government on the best way they can make decisions, and also to advise them on all tools that we have that can contribute to protect children and their parents when they go back home. Dr. Moiti, over to you.
Yes, thank you very much, Dr. Kaseya. Indeed, the issue of schools opening and children gathering there, particularly in the areas where the virus is circulating, is very, very important. I mean, that's why it's critical to emphasize very much community, family, knowledge, information, and back that up with capacity to quickly inform the health system at the local level about anything that might look like a case. It's very important for the people, including the students, the families, the school authorities, to be made aware of the risk of Mpox where there are outbreaks and cases already occurring, so that they know very well how to recognize in themselves and in families when somebody might be ill, and they know what actions to take in terms of getting them in contact with the health system, getting information about how to avoid being contaminated in the household, getting the supplies that they need in order to prevent that, and then where the vaccine is available, clearly, as Dr. Kaseya has outlined, ensuring that the system is aware that something that looks like a case is diagnosed, and those in the household and others are protected. I think for schools, it's very much ensuring that the authorities are aware, the students are aware, the health services of the schools are also aware in case there are cases that arise, and the students are aware of what they need to do in case there are cases within their families to avoid, if they may be infected, spreading that within the schools. So just emphasizing information and the correct information to everybody in the communities, but particularly to people who are going to be gathering in places like schools, places at work, is very, very important in this response. Over to you, Dr.
Yes,
Kaseya.
just to add, yes, thank you, Dr. Mati. We don't have all the answers, let's be honest. It's also learning by doing. We knew there were clade 2, and we have managed clade 2 in 2022 when it was in the US and in Europe. But clade 1b is something of an unknown. We don't completely know the way it is transmitted, and we need to also gather more epidemiological data. So it's very important that with the vaccination campaign, we see how it develops, what is the impact, and how we are breaking the transmission chain. So it's a work that we will conduct now in the coming weeks, and that is important that we adapt our strategy according to the impact of the vaccination. The one thing that we are also launching together with AfricaCDC is a new initiative on diagnostics, because we need to have rapid diagnostics to know whether it's clade 2, whether it's clade 1B, and so on. So we are launching a big initiative called PANTA, Partnership to Accelerate Monkeypox Testing in Africa. And we'll also rely on local production to develop those diagnostics. And that is also an important element that is part of the answer. We need to have surveillance, better data to ensure that the vaccination campaigns are well targeted and efficient.
Thank you very much. We'll now take 2 more questions from the floor. Rory, you can come in, you have the floor.
Hello, thank you. So my name is Rory O'Neill. I'm from Politico. My question is, did any EU countries take advantage of their ability to purchase more doses for donation under HERA's joint procurement contract with Bavarian Nordic? I know the Health Commissioner flagged that as an option countries could take in her appeal to EU member states. I'm just curious if any decided to do that. Thank you.
Thank you. Let's take one more. Sarah Javing, you can come in. Sarah, if you can hear us.
Hello?
Can you hear me? Can you hear me now?
Yes, we can hear you. We can hear you, Sarah.
Okay, thank you. Can you talk about how WHO and AfricaCDC will divide responsibilities in this joint plan? Kind of what will be the different roles both organizations will play, and how will funding be divided among the 2 orgs as it comes in? Thank you.
Thank you. Over to you, DG.
Yeah, the first question is for Laura.
Laura.
And the second one, Dr. Mwete and myself will respond to that.
As regards the first question in terms of are we going to buy extra doses to Bavarian Nordic, the member states, it's a combination of additional doses that are going to come. It's a combination of existing stockpiles, so what they have as a safety net, the stockpile, and some procurement that they're going to do in the coming days. So it's a combination. Some member states will only use a stockpile, some will procure additional doses, and some will do a mix between the stockpile and new procurement.
Yes, Sarah, thank you for your question. I have to say I like your questions because it's challenging us too much. When you talk about what would be the responsibility of WHO and AfricaCDC under this continental response plan, I think we need to share with you the document. You'll see under page 14 of that document, we are talking about how AfricaCDC and WHO will work closely together to co-lead the response. And it gives also the comparative advantage of each organization, and it gives the way we are co-leading the incident management team. You know, this is a team of mostly 15 organizations, even more that will come. And our responsibility are also coming from our mandate and our comparative advantages. But the main word, everything is not written somewhere. We are co-creating. As Dr. Mwete said, it's the first time that we have this kind of mechanism. Co-creating means we are doing our best to see how we can continue to collaborate and to co-lead this mechanism. And we have a strong mechanism to avoid any kind of conflict. And we are working with all partners to ensure that all of us we are very well aligned. in terms of where funding will go, you will see under the Continental Response Plan, we have what we call pillars, and we have also all partners working under each pillar. That one, you'll find it also in the Continental Response Plan, what we call the technical working groups. The way we are advocating for funding of this program is to ensure that each partner knows who is working where. If we talk like about risk communication and community engagement, you will see the lead is sitting with UNICEF and IFRC. It means if we have a specific partner who want to provide funding, they know where they can put money. Let me give you an example. I was talking with Mastercard Foundation. They told me we have initial $15 million we want to contribute. And because we know that vaccination is a critical issue today, as someone wrote, we need to strengthen the communication part of the countries. Logistics is a major concern. Then the 15 million went to UNICEF for 35 million and WFP for 15 million. You see, this is the way we are dividing our role, because UNICEF will support communication and logistics. WFP will also support logistics in some areas. Dr. Mweti will understanding and make it, if you want to write on that, say Africa is co-creating a coordination mechanism. Over to you, Dr. Mweti.
Yes, thanks very much, Dr. Kaseya. No, I'd just like to underline the fact that the shared responsibilities are very much around coordinating the overall response, including the contribution and the interventions of the other partners that are going to be part of this partnership to support the governments, and emphasizing that the main responsibility of implementing this is the national governments. And what we are doing as partners is coming to support them, and what WHO and the AfricaCDC are doing is then coordinating the interventions of all the additional organizations and partners that will be working with the government. So we have a so-called core incident management function, which we share. And I'd like to emphasize that this is not the first time that the AfricaCDC and WHO will be working together in this way. We did that when we were supporting the response to COVID-19, particularly the technical aspects of COVID-19, with a very strong high-level technical platform that we had established early in the pandemic with the AfricaCDC. And then it'll be up to us to see how to coordinate what's going on around research and innovation, around operations, looking at what everybody is doing, and of course planning, as we did, coordinating the development of this plan that we're launching today, looking at the administration and finance together. And then in the field, because we have a group that's going to be operating out of, if we take the DRC, where we are coordinating the overall continental response in Kinshasa. And then in the Eastern DRC, for example, we'll be working at that level. We'll need to put in place an incident management team, which will have colleagues from both organizations working with the government at that level to organize what everybody is doing. I would like to emphasize that I think we have a clear view of how to do this, and we have had experience in doing it before, and ensuring that we support and coordinate what all the other actors and partners are doing, very importantly, in order to support what the government is doing, because that's where really that will be the basis of the major action within the national system, both health and other sectors.
Thank you, Dr. Moeti. I have 3 more questions here for the HERA Director General. First one is on how HERA intends to support resource mobilization disease outbreaks like Mpox, particularly to conflict and climate challenges. That's the first. The second question is Mpox out being a significant threat to health security in Africa. How is HERA supporting preparedness and resilience building efforts to handle health crisis in this region? Over to you, DG.
Well, thank you very much. Well, it's what I have already outlined before. We are still working hand in hand with AfricaCDC and WHO to support the capacity of Africa. There's a project with AfricaCDC on what we call PGI, Pathogen Genome Initiative, building capacity to detect new virus, detect new outbreaks, so building lab capacity, building detection capacity that we can rate. It's very important that we are better off in terms of detection. We are supporting the continent with vaccine. Europe, Team Europe is also supporting Africa with building more capacity in terms of vaccine production. We know that, in fact, maybe it's not known, but in fact, on the continent, we have been producing vaccine for dozens of years with the Institut Pasteur of Dakar in Senegal, producing yellow fever for more than 80 years, I think, yellow fever vaccine. And now we have launched a big initiative during COVID time, for the first manufacturing vaccine facility with a total budget of 1.3 billion environment support the development vaccine production in Africa, and there are a number of programs vaccine production Rwanda, Senegal, South Africa, Ghana, Nigeria. So it's new. So we have vaccine production supporting that process. So there's a lot of initiatives going on to be better prepared for the next year.
More from the floor, the warnings from you can come in. Can you hear us? All right, let's move to the next person. Lara, you can come in.
Okay, good afternoon. Can you hear me?
Yes, we can hear you.
Okay, so I guess my question was asked initially, but there was network issues, so I couldn't. So my question is, my questions are: when we AfricaCDC start distributing Mpox vaccines to African countries, and when will Nigeria get the vaccine from the center, and how many doses are we likely to get from the AfricaCDC? Those are my questions. Thank you.
The next one. Thank you. Alexander from Reuters, you can come in. Alexander, can you hear us? All right, let's take one more from the chat room. This one is coming from.
Hello, how about now? Can you hear? Sorry, can you hear me now? I couldn't unmute.
So has UNICEF or? Yeah, we can hear you.
Okay, great.
Yes, we can hear you. Go
Brilliant.
ahead.
Thank you. I would just like to first ask Dr. Kaseya just to confirm if the case in Guinea, when the sequencing comes back, if that is confirmed as a case of clade 1B, could you say, would that be the first case of clade 1B in West Africa? I thought you said that would be interesting to know. And then the second one was, I didn't catch this earlier. I think you may have touched on this, but on when vaccine doses might get to Burundi, did I understand that you're waiting for a certain type of plan from some countries like Burundi on how they would use vaccines before vaccines can be sent there? Yeah, and when that plan might be ready, when Burundi might get its doses. Thank you.
Up to you, DG.
Yes, the first question, how many doses the colleague said they're expecting? I didn't get which country visit, but let me tell you, I think Dr. Monkey made it also. We are led by equity and we are led by solidarity. An example, the first doses that we secured from ERA, we have 215,000 doses. But you will see that DRC got only 200,000 doses. And we have 15,000 doses now we can allocate for countries. But why are we using this vaccine on more safe way? Because WHO already, Dr. Moetin said that WHO already released authorization for Gavi, UNICEF, giving the emergency use. But it's important at country level to ensure that countries, they accept to use them. And this is why we are requesting all countries to fill the form. It's even mandatory for the for Bavaria, Nordic, before releasing this doses. It's one of the requirements. I think we did the same for DRC, and we hope it will go quick. As I said, we got a response from Cameroon. They are working on that. We are supporting them, all of us, WHO, AfricaCDC. Regarding clade 1B in West Africa, it will be the first time for us. I think if we have the continental response plan, page 3 is giving the mapping of all clades. You'll see clade 1B is mostly in DRC, in the eastern part of DRC. But for other parts, like the West Africa, we have what we call the clade 2. I don't want to jump to conclusions. I will wait to see what will be the result from the genomic sequencing. Yes, if Guinea has clade 1B, it will be the first one in West Africa.
Thank you, DG. Take 2 more questions from the chat box. One is about the number of Mpox cases in DRC as compared to other countries in Central Africa. So what's the, why is the number very high in DRC compared to other countries in Central part of Africa? The other question is on the fact that not very much has been done regarding awareness of Mpox. Is there funds allocated for campaign, especially in hard areas? Over to you, DG.
Over to you, Dr. Moeti.
Okay, thanks very much. I mean, I think the Democratic Republic of the Congo is the epicenter of this outbreak, and it's a country that has had Mpox essentially endemic. And then there's had outbreaks through the years. And what has happened there now is that in this eastern part of the DRC, where there is a lot of population movement, where there are many displaced people because of the particularities of the situation, and where there is a lot of in-migration and population movement from neighboring countries, and the virus changed, and the new clade, the new variant of the virus has arisen, which seems to be particularly transmissible. So the conditions there, the way people are living, the high rate of migration of people, because the situation is not only acute among children, as we are quite often stating, but also among young people, where there are a lot of mobile people coming in from neighboring countries into that economic mining area, many sex workers. So the spread of the disease in this particular outbreak in the Eastern DRC is different from other parts of the DRC and also areas where this disease is endemic. So it's a kind of epicenter of what's going on in the region right now, the eastern part of the DRC. But as we've already indicated with reference to the case 2 of this clade in Guinea, we know that we live in a very interconnected sub-region, as has happened with the spread to Burundi, Uganda, and neighboring countries in Eastern Africa. And recalling the other global outbreak that happened, we have seen spread really in many countries, which emphasizes, in my view, the importance of this plan. As I said, we have classified countries based on their degree of risk, where there is intense spread, as is happening in the Eastern DRC and other places where there is transmission happening, and then right down to countries where we are working very much on building the preparedness and readiness to address in case cases appear, as has happened in Guinea. I think that's what's really important in this joint continental plan with countries in different situations and levels of risk, with the DRC the most severely affected, where the majority of cases are occurring at the moment.
Thank you, Dr. Moeti. Thank you. We'll take 2 more questions from the floor. Esther Nakati, you can come in.
Thank you very much. I hope you can hear me very well.
Yeah,
Can you hear me? Okay.
Yes.
So we know that vaccines work for prevention, but I wonder if the market has any therapeutics for the people who are already affected, especially the children in Congo who are sick and may not benefit in terms of having a vaccine. So my question really is, are there efforts to procure any therapeutics for people who are sick? Thank you.
Let's take the next one. Michael Voss, you have the floor.
Thank you. How many vaccines do you need now in total, and how many vaccines will you need within the next 2 years? Thank you.
Thank you. Over to you, DG.
Yes. Let me start with therapeutics. You know, we have what we call the Poxviridae. Sorry, but this is the name. The Poxviridae was used in Europe and other continents, mostly for clade 2, with success. But the study was conducted in Africa for clade 1, especially 1B, and that one didn't really show the efficacy of this medicine. Yes, we are still conducting some studies to see if we need to adjust the doses, if we need to also have some other products. But for now, we still have the Poxviridae to be used for clade 2. I have to inform you that I got a message today from Indonesia. They want to give a huge donation of the Poxviridae to African countries. I think that one we can deploy that to countries affected with clade 2. In terms of vaccines, I think we are clear. We are saying that we have some specificities in Africa. You know, we cannot approach the vaccination strategy in Africa as we are approaching that in Europe or the US. First, because the surveillance in our continent is still weak. While we know that in the US, in Europe, in other continents, they can report with some data that are accurate in terms of people who are affected or people who are in contact with others. Because our surveillance is still weak, we don't have a clear picture of what is going on in all of our countries. The second one is about some countries sharing information about suspected cases, but they are unable to test that because the testing is another issue. And there are a number of limitations in terms of testing. We know samples can be collected, how the samples can be transported, and what is the quality of the sample that can land to some labs, what is the machine that they are using. As you know, currently, we don't have a rapid test, And gene expert that we are using is not giving us diagnostics against clade 1. We are deducting the conclusions from what we have and the epidemiology. And we need to have more qPCR that will help to identify the clade and then the genomic sequencing to give more information regarding the. I think for now, based on that, our vaccination strategy is to say, okay, let us use vaccines to stop the spread of outbreak by considering that not from prevalence, but also by considering the reality in Africa in terms of vaccination. We are saying that we need more vaccines. And I saw a question about the 10 million doses we are talking about. It's written in our plan how we are approaching the vaccination strategy. What we are, the hope that we have, we discussed with Bavaria Nordic, they are doing the tech transfer technology to African manufacturers. From 2025, we hope that Africa will start to manufacture these vaccines for us to cover all people in need. Don't forget that Mpox is a zoonotic disease, and as Dr. Monkey said, we're living with that from very long time, since 1970. But it means even if we stop the current outbreak, we really need to make sure that we'll not have the same trend in the future. Then we need more vaccines to support our people.
Thank you, DG. Let's take the next two from the floor. Simi from BBC, you can come in. Simi, can you hear us? All right, let's.
Hello.
Yeah, we can hear you. Go ahead.
Hi, sorry.
Okay,
Can you
good
hear afternoon. Good afternoon. I'm Sally from the Gambia.
Hello.
Sorry, let's take Simi first from BBC, and then Sally, you'll be next. Simi, you can come.
Thank you. My first question is, what is your strategy to deploy vaccines to villages and IDP camps in the eastern part of the DRC, considering the ongoing armed conflict? And then secondly, what are you doing in the meantime to ensure camps have adequate supplies, as doctors have said they are running low?
Thank you, Simi. Sally, you're next. You can come in. If you can hear us.
Yes, I'm getting you. Thank you so much, DG, and the rest of the speakers. My name is Sally. I'm from the Gambia, West Africa. So my question will be, I know a lot of concentration is on countries, especially in the East, that have registered cases of Mpox. So what is AfricaCDC and WHO doing with countries that have not yet registered cases in terms of surveillance and preparedness to make sure that they are not gotten into surprise when cases are registered, now that we have already gotten a suspected case in West Africa? So that will be my question for now.
Thank you, Sally. Over to you, DG. Dr. Moeti, over to you.
Okay, thank you. Thank you very much. Just the first question about the context in the Eastern DRC, the humanitarian context, people, displaced people, quite large numbers of displaced people. To say that, of course, the key, first of all, the government is present, WHO and other partners are present, and including groups like the International Federation of the Red Cross are on the ground working on an ongoing basis to provide health care and prevent diseases in these contexts. So what we are doing, as I indicated in my statement, is to scale up, first of all, work with these partners, and then expand our presence based on the teams that we have in the country, because we're present in the countries. We have a country office in in Kinshasa, and we have sub-offices around, including an office in Goma. So what we are doing is mobilizing some of our staff and moving them to that area to support this work. We have staff already that have been working on polio in the Democratic Republic of the Congo. So we're going to repurpose some of these to support the response to the Mpox, and are working very much with some of the partners out on the ground in the UN, UNICEF, IOM, who are already working in these areas of uncertainty, conflicts for population that has been displaced, to incorporate the Mpox response into what is already being done to deal with disease prevention and access to essential services for these populations. So it's very much a matter of partnerships in these areas. And then the second question about what is being done in countries that are not yet affected. As I indicated, the intervention has grouped countries based on the epidemiology, the situation, including supporting very much preparedness and readiness in the countries that don't yet have a case. So sharpening their capacity to detect a case when they come in, sharpening their surveillance capacity, ensuring that they have the means, if a case arises, to respond rapidly and quickly to contain the disease outbreaks in the way that we do based on disease preparedness and response already on the continent. We've trained as WHO in now over 30 countries what we call a surge capacity. So we have trained a group of sometimes 50, sometimes 100, depending on the country, public health responders within the country that are of different disciplines that are available to be mobilized when there's an indication that an outbreak is starting, and are the first responders while we look to see if there's a need to bring in and mobilize additional capacity to bring those in. So the countries, as we speak, are planning. Most of the countries now are developing either response plans if they're affected or preparedness plans. And part of what we're going to be doing with the funding that we're going to mobilize around this continental plan is to address the needs of countries at different phases in terms of being affected by the Mpox outbreak. Working with partners, clearly, and particularly with the AfricaCDC.
Yes, just to complement on that, there is no activity in the context. And congratulating the President of Angola, President Mugasa, the ceasefire in Eastern part of DRC. We also ask congratulating the President of Rwanda, the President of DRC, for accepting the ceasefire. We really hope the ceasefire will continue to give us opportunity to reach all people in need without putting our own staff at risk. I think if there is something that we can get from what's happening in the Eastern part of the US in terms of security, is this clade one that was discovered around June 2023 in the Eastern part among people who are affected. In addition to all capacities that we are putting in place, and from all partners, another example of how the security can affect is polio in Gaza. You see, it means we really need to strongly come together to say we need peace in the system about the DRC to reach all people that over.
Thank you, Dee. Let's take the next to the floor. Simfiwe from Zambia, you can come in.
Thank you. Thank you, Margaret. My name is Sim. Yes, my name is Simfiwe from the ILO. I'm based in Pretoria for the decentralized team for Eastern Southern Africa. I just have one quick question. Do we have an indication whether the health workforce is being affected I know that they do have to apply universal precautions, but I'm just thinking that in countries where the incidents are higher, whether there is an indication whether the health workers are affected. Thank you very much.
Thank you. Let's take the last one from Mutasem from SciDevNet. You can come in.
Okay, can you hear me now? I think you can hear me now. Okay, thank you so much.
Yes.
I would like to follow up on local manufacturing of vaccines. DG have mentioned before that the demand is expected to go for long for Mpox. It's an endemic disease. But we've heard like lately the CEO of Aspen and Pharmacare South Africa saying that we can actually take the vaccine, we can go into agreement for tech transfer, but we need commitment that governments or that someone would buy the vaccines in volumes. So my question is there any commitment from African governments or from Gavi that on the long term they can buy locally manufactured vaccines in Africa? Thank you.
Thank you. Over to you, DG.
Quickly, these two questions. The first one is whether business of export of yes. The DRC in the region of Santogo in the quarter, we had the business and we have reported we can consider that they are at risk for it. In terms of local manufacturing, look, local manufacturing is a major priority for the African country. Head of state, they decided to move forward the local manufacturing from the idea to AfricaCDC is mandate to ensure that we can manufacture not only vaccines, but therapeutics and diagnostics. And what we did, we also created what we call the African Food Procurement Mechanism. That will help us and not only to secure the demand, but also to ensure that once the product is manufactured, we can buy and make it available for all African countries. Currently, for Mpox, we clearly see there was a process, and Aspen is one of the manufacturers we are considering for the state transfer. And it's normal for the CEO to say, we'll move on if there is demand. The demand will be the demand. I think in our continental response plan, it's clear that the demand is there. I think countries, they are expecting the demand. And what we have to do is to make sure that once the state transfer is finalized, we create the conducive environment for Aspen or any other manufacturer to ensure that
Thank you, DG. And with that, we've come to the end of our press briefing today. I'll just give the floor to the DG for his final remarks.
This is really an opportunity for us to thank all of you members of the media by thanking also my sister, Dr. of WHO and my best friend, Global Mission, the DG. You will see that we are co-creating the model, bringing all partners together. It's just when we are together that we can live. And that one, we are also building the foundation of the next pandemic, because all of us know that the pandemic is not about if, it's about when. We are building the mechanism of how to work together by putting in place a strong foundation. In terms of coordination mechanisms, in terms of digital transformation, in terms of surveillance and lab network, but also more important in terms of human resources, including the data. This is really where we are moving on. We see the outbreak is still there, not controlled. We still have more cases, more than 5,000 cases in 1 week. And we need to continue to work with our member states and all partners by
requesting more funding for the continental response plan to ensure that Africa can be out of the outbreak in a few months, and the world can be safe because Africa will be safe. We thank all of you, and we wish you a very good evening or a good night for somebody.
Thank you for joining us. Thank you.